Okay, welcome you guys. So today's topic of learning is oncology, that is cancer. So cancer is common in nowadays because it is same like a hypertension, diabetes mellitus you can see in our every homes. So because of a habits or diets, or because of some like a consumption of alcohol. So cancer also one of the common disease nowadays. So today's our topic is that is oncology, that is a cancer. If you break the word oncology means that is a onco means a, bulk, a bulk or a mass or a tumor. So it is also known as tumor. Then logy means a study. Logy means a study. So this is the meaning of oncology, that is onco means a bulk or a mass or a tumor, then logy means a study. So if you combine these words means what will happen, that is it is a branch of medicine that deals with the study, detection, treatment and management of cancer. So what is oncology? It is a branch of medicines that it is deals with study, treatment, detection and management of a cancer or tumor, that is known as oncology. So that is called as oncology. So in oncology there are three primary disciplines are there. So three primary disciplines are like a medical oncology. First we see that is a first one, that is a medical oncology. Then second one is a surgical oncology. Then third one is radiation oncology. So there are three primary disciplines are there in oncology, that is a medical oncology, surgical oncology and radiation oncology. So medical oncology means treatment of a cancer with the help of the medicines, that is chemotherapy drugs. So with the help of drugs we can treat the oncology, that is called as medicines. Then second one, surgical means with the help of a surgical treatment, that is a resections or removing some of the body parts which parts are affected for the cancers, they remove that part, that is surgical oncology. Then third one, that is radiation. With the help of a radiation, that is a X-ray radiation, we can kill or shrink the cancer cells. So these are the three primary disciplines are there in a cancer, that's a medical oncology, surgical and then what is cancer? So what is cancer? So this cancer word is derived from Greek. So Greek word, that is crab. So here all are seeing in the word picture, that is a crab picture. So this cancer word is derived from this crab. So crab, why it is why it is derived from crab means, if you see the crab, it can run at any direction. If you just keep the crab at this direction means it can go for this direction. If you keep the crab for this direction, it can go same way. So cancer also, if the person got affected means it can spread to the whole body parts. So that's why the cancer is word derived from the crab. So in cancer there are two types are there. First one is a benign type of cancer and a malignant type of cancers. So in cancer there are two types are there. There is a benign type of cancer and malignant type of cancer. First we discuss about the benign type of cancers. So in benign type of cancers, in here there will be mass will be fixed. So cancer will be fixed at only one side and it will not spread to the other body parts. So benign type of cancer, here mass will be fixed and here there is no spreading of other organs. And benign also, it is a smooth and regular in shape. So there is a multiplication of the cell also very slow in a benign type of cancer. So it will be smooth and regular in shape, and there is no involvement of lymph nodes in benign type of cancers. So So in benign, there is no involvement of lymph nodes. So lymph nodes, they act as a immune system in our body. So here is a benign type of cancer, there is no involvement of benign, so there is no involvement of lymph nodes, and there is also the metastasis is also not present. So metastasis means it is one of the development of secondary sites. So development of a secondary sites at a primary, so development of a secondary malignant growth of a cells from primary site, that is called as metastasis. So as I told, the cancer, it is one of the uncontrolled growth of a new cells or tissues, that is known as cancers. So here the, as I told, the cancer, it is uncontrolled cell growth. So cancer, it is one of the uncontrolled cell growth or tissues, so that is not a cancer. Here also in metastasis, that is there is a development of secondary malignant growth of a cells or tissues from primary site, but in a benign type of cancer, the metastasis is completely absent. As I told, and second one is malignant type of cancer. So malignant type of cancer, here the mass is movable, so mass will be moved from one place to another organ. So from one organ to the another organ, the mass will be movable. It can spread to the other organs. If your person is suffering from a oral cancer, means it can spread to the lungs, sometimes it can spread to the brain, or it can spread for lungs, stomach. So same way it spread to the other organs. But a malignant, so it is a one of the rapid growth will be there, so there is a fast growth of the cancer cells will be there, and it is a irregular in shape. So here the malignant is, it is one of the, it is irregular shape. Here there is a involvement of lymph nodes, so there is a involvement of lymph node is present in malignant type of cancers. And also same, most important, metastasis is also present in the malignant type of cancers. So this is a differentiation between the benign and malignant. Benign means is the mass will be fixed and there is no spread of the organs, and it is a cell multiplication is very slow, and it is a smooth and regular in shape, and there is no lymph nodes involvement, and metastasis is absent. But in a malignant, the mass is movable, it can spread to the other organs, the rapid growth will be there, the cell multiplication will be very fast, and it is one of the irregular in shape. The metastasis is present and lymph nodes are involved in the malignant type of cancer. And next we study about the etiology of cancer. What are the causes for the cancer? So there are many factors which can cause the cancer. Some of the factors which we will discuss in this video, that is the first one is that is etiology of cancer. The first one is there are some physical agents. So physical agents means that is a, so we can call it as a physical agents like that is a radiation. So physical agents are like radiation. We can see the radiation, harmful radiation. If a person is exposing for the sunlight, or exposed for sunlight, or in case the person is living in a high altitude area. So if a person is living in high altitude or a high humidity area, means so cancer is very commonly seen in that type of persons. So these are the physical agents. The next one is chemical agents, means inhaling of chemicals. So that is smoking. Smoking, if in a smoking, the inhalation of a nicotine, so that can cause the lung cancer. So that comes under chemical agents. And drugs, if the person taking any type of drugs or etc., so they comes under chemical agents. Then third one is genetics and family history. The only two cancers are there, so which can spread from generation to generation. The two cancers are like colon cancer and breast cancer. So these are the two types of cancer which can spread from the family to family, that is generation to generation. Only two types of cancer, they can spread to generation to generations. And next one is another etiology, that is dietary habits. So dietary habits like for example, intake of a low fiber or consumption of bakery foods, or consumption of Alcohol, so alcohol that can cause the liver cancer. If you consume the more and more alcohol means it can cause a liver cancer. That is comes in dietary habits, that is low fiber consumption of high fat or alcohol or a processed foods. So these are comes under in dietary habits. And next one is viruses and bacteria. First we discuss that is a virus. So in virus there are uh, two types are there, that is a RNA virus and DNA virus. So there are two types of viruses are there for that causing the cancer. For first we discuss RNA virus. RNA virus are like HIV. DNA virus means DNA viruses are like first we discuss about RNA virus. So RNA viruses are like HIV, human immunodeficiency virus, and HTCLV virus. HTCLV means human T lymphotrophic virus 1. Human T lymphotrophic T lymphotrophic. So human T lymphotrophic virus 1. So that is meaning of HTCLV. So HIV virus and HTCLV virus, these are the two RNA viruses are there. And DNA viruses are like, so DNA viruses also there. So DNA viruses are like hepatitis B. So that is hepatitis B. Then EBV. So EBV means Epstein-Barr virus. So EBV means Epstein-Barr virus. Then CMV means cytomegalovirus. So CMV means cytomegalovirus. So these are the DNA virus, that is hepatitis B, EBV, and CMV. Then bacteria, that is bacteria which can cause cancer, that is H. pylori. H. pylori. So this is one of the bacteria which can cause the cancer, that is Helicobacter pylori. So these are the etiological factors of cancer, that is a physical agents, that is radiations, high altitude, a person living in high altitude, humidity area, sunlight exposure to sunlight, and chemical agents are like smoking or drugs or dietary ingredients. Then genetics and family history, that is colon cancers and breast cancers. Then dietary habits like a consumption of alcohol, low fiber intake, and high fat with the diet, so they can cause a cancer also. Then viruses and bacteria are like so there in virus there are two types of virus, that is a RNA virus and a DNA virus. That is a RNA viruses are like HIV, then HTCLV, that is human T lymphotrophic virus. Then DNA viruses are like hepatitis B, Epstein-Barr virus, then cytomegalovirus. Another DNA viruses are like papilloma virus that can also cause a cancer, papilloma, herpes. So they can cause cancers. And next we discuss about the main signs and symptoms of cancer. So there are 8 symptoms which can detect the cancers. The first one, that is unusual bleeding or discharge. The first symptom, that is unusual bleeding or discharges. So bleeding from the any breast site or bleeding from a vagina site or a penis regions or in case of any parts. So there is a discharge will occurs. That is the first symptom of cancer. And there is a changes in bowel and bladder habits. So bowel and bladder habits will also changes, that is changes in a size, shape, and color of the stool. So that will be changes in bowel and bladder habits. Then third one is sore throat. So if you person get affected for the infection of sore throat means it will not heal soon, it will take maximum 3 months, 6 months, or it may continue. So there will be sore throat, does not heal. The next one is nagging cough and hoarseness. So there is continuous cough will be there for the cancer affected persons, and changes in the voice. So their voice will be changes, there is a harshness of the voice will becomes, and there will be a sudden weight loss will occurs for the person. So that is a sudden weight loss. And changes in the moles. So there is a changes in the moles, that is a coloration of the moles, and that the moles will become a darkened, and they will become a thickened, and size also getting large. So there is a changes in the moles and warts. Then another one is indigestion. So that is proper digestion will not occur for the cancer affected patients. So there is a difficulty for swallowing, or a indigestion will be happens. And there is a last one is thickening of the lumps. So there is a thickening of the lumps. There is a formation of a lump in the breast regions, or in case of any other body parts, there is a formation of lumps, and they can got a thickenings. So these are the 8 signs to detect the early stage of cancers. If the only person suffer from only for 1 week, 2 weeks, so we did not call it as a cancer. So prolonged period of the person suffering from these signs and symptoms means we can early detect the which type of cancers, and further will be continued in the next class.